Hi, Dr. David Schiller here, and I'd like to welcome you to our shoulder pain page of my website. And I want to go over all the different reasons why a shoulder can start to malfunction. And for many of you, it's not what you think, because many people think the problem can just be in the shoulder, and that's not true. Over my 20 years of practice, being a certified chiropractic sports physician for the majority of them, 3/4 of the time I've been a certified sports physician, shoulder pain does not just come from the shoulder. You may certainly have an injury in that shoulder, but for the most part, it's probably being driven by another part. So you got to understand that the shoulder may not be where the problem is, even though the pain is there. Yes, you do want to identify the injury. Is it an impingement? Is it a torn rotator cuff? Is it something else? And that can be done through imaging. Maybe you've had MRIs before, x-rays. But the idea is, if the problem is not going away with a typical therapy, typical exercise, then it's not just about the muscle. You could have arthritic changes that are going on in there because you have inflammation driven from the foods you're eating, or inflammation driven from the fact that it's an old injury that was never taken care of. See, injuries persist if they're not fully rehabilitated. There could be problems because of a postural distortion. And for every shoulder problem I've ever seen, and by the way, that's how I got into this profession. I was a 14-year-old, a swimmer, and one morning I couldn't lift my shoulder up over my head. I went to the emergency room, I got the x-rays taken, they gave me a sling, a bottle of Tylenol, and they said, "You have tendonitis, see you later." Didn't do anything, didn't direct me towards physical therapy, just said, "Well, you got tendonitis." I eventually got myself to a chiropractic doctor who understood the concepts of what I'm about to tell you, and as a result, to tell you the truth, never really went near my shoulder, because my problem is coming from my spinal issues, because it's the spine that controls that shoulder. It's the nerves coming out of the lower neck, upper back, that go down into the shoulder and drive it. And in my case, that was my problem. So by correcting those things, I was able to recover. Now, for most people that have shoulder problems, what I have seen is that they're all related to some type of postural distortion. Over the years of time, as the brain starts to wind down, the body starts to curl over. There's internal rotation of the shoulder girdle, and as a result, you're very powerful this way and very weak in the back. As a result, that imbalance from front to back, every time you move that shoulder, you're wearing and tearing on that shoulder. So you must identify, okay, is there a postural distortion? So far, is it inflammation coming from just general inflammation of the body where you've had old injuries and it's never was taken care of? Do you have a spinal issue of the nerves coming out of the lower neck, upper back that control that shoulder, and they're interfered with, and now the shoulder is malfunctioning? Do you have postural distortion that's causing an imbalance of the power to the front versus the back, and as a result, that shoulder starts to get worn and torn? There's two more. The other one could be, there could be a cross patterning to opposite sides of the body, where, for instance, right shoulder can be related to left hip issues. Just like if a person had a tennis elbow on the left, we want to look at the knee on the right, because there are these neurological connections between the opposite sides of the body. Do you have a problem not just with the shoulder here, you have the pain here, but there could be a problem over here because of compensation and because of the cross-cord patterns, these neurological patterns that occur, you now have a shoulder problem on the other side. And lastly, there could be a brain issue. There's the brain that drives the function of the shoulder. So let's say you had an injury long ago, never produced enough damage in that shoulder to cause the problem then, but the damage was enough to start driving maladaptive information back up to the brain. They have done studies looking at people that were in casts for weeks on end. The part of the brain that represents that body part that's in the cast starts to shrink. So the part of the brain, if it's a right shoulder problem, if it's been restricted in movement for months or years and you didn't know it, you had pain, you didn't have pain, it doesn't matter, there was an imbalance in that area, that part of the body part that's represented in the brain, that part of the brain starts to shrink. So you need to look at, is the brain involved? So these are all the things that you need to look at with any neuromusculoskeletal problem, whether it be a knee problem or an elbow problem, but particularly when it comes to shoulder issues, you need to have this broad outlook on the thing. You need to look at the nutrition of that individual. You need to look at the posture of that individual. You need to look at the other parts of their body that may be malfunctioning, contributing to that thing, and you need to look at their spine. So the idea is you have to look at the whole thing. If you really want to get rid of the problem, you need to have a doctor who understands all these things, especially if you've been dealing with the problem and it's not going away. So I hope this information was helpful, and make it a great day.